Psychotherapy or counseling, and I'm kind of using those two words interchangeably to refer to the same thing, has been shown to be a safe and a very effective way of treating depression. Lots of research has established that psychotherapy is very effective actually for helping people with depression. So these are average numbers, but we know that on average 6 out of 10 people who have up to 20 sessions of psychotherapy are going to show significant improvement in their depression. Of those people that were successfully treated with psychotherapy, 75% of them a year later will still be depression free. On the flip side, approximately 25% of people will experience a relapse with depression. And we know that relapse is a common thing that people who have depression struggle with. It can tend to be reoccurring. And so booster sessions or follow-up sessions can be very helpful for some people. So psychotherapy can be provided by a number of different healthcare professionals. So for example, psychologists, psychiatrists, family doctors, nurses, and social workers, all of these regulated health professionals can provide psychotherapy. It's important if you're seeking psychotherapy to try to find a healthcare professional that is in fact regulated. And what that means is that there's a professional body that oversees the group of people that are practicing to make sure that their qualifications are up to date, to make sure that they're competent and capable of providing that service. And then if you did have some concerns about your work with that individual, you would have an identified group that you could go to express your concern or your lodge a complaint. And so it's very important that you seek a highly trained, highly qualified professional that is going to be accountable for the services they provide to you. So your first session with your therapist will be a chance for your therapist to hear about what your concerns are, what you're struggling with at this time and what's brought you to seek their help. It's a chance for them to hear a little bit more about you as a person as well. So to get some background information, to find out more about who you are, your interests. It would be important for you to be as open and honest as you can with your therapist when you meet with them. But it's understandable that the first few sessions are going to be a time when you're still getting to know them and becoming more comfortable with them. And it may take some time for you to be able to open up completely. Now, having a really good fit with your therapist is really important. So feeling like this person trusts you, or that you trust them, feeling that they like you and you like them, feeling like there's a good kind of rapport or a good working relationship is really, really critically important. So after 2 or 3 sessions, if you don't have a good vibe, if you don't feel like it's going to be a good connection or a good fit for you, then it would be really important to kind of raise your concerns with your therapist. And if they're not able to kind of change or alter what they're doing to suit your particular needs, then I would really recommend that you look to find another counselor or a different therapist. And there's no problem in doing that at all. It's really important to shop around until you find the right fit for you. So after those first few initial sessions, things will shift a little bit to focus on helping you better understand and resolve the difficulties that have brought you into therapy. And the way that those sessions will unfold might look a little different depending on the particular therapist you see or the particular kind of therapy that this therapist is offering. And I would encourage you to speak with your therapist in more detail and ask him or her about what approach they propose to take with you. Make sure it makes sense to you, make sure it feels like a good fit to you and something that you can really get behind and commit yourself to working on. If the plan that your therapist is proposing doesn't feel like a good fit for you, know that there might be other ways you could proceed either with them or with a different therapist. And know that there are options, and that's the main point I'm trying to highlight here, just that there are a variety of different approaches that have been shown to be effective. It's also important to recognize though that it really is going to require something of you. Unfortunately, there's no magic pill where your therapist can just sort of reach in and change things for you. They're going to be your guide, they're going to be your teacher, they're going to be your support, they're going to walk with you, but it's really going to be you making a lot of these changes. And so, honesty with yourself and being honest with your therapist is really important.